Thank you for tuning in to watch our Invest Nashville 2024 launch conference. You're about to watch panel number 3, Future Ready, a look at the symbiotic relationship between healthcare and education in Nashville. Enjoy.
So this is our third and final panel, and we're going to talk a little bit about being future ready, how promoting a symbiotic healthcare education relationship positions Middle Tennessee economy to meet emerging trends. I'm Melanie Thomas. I'm the Chief Information Officer at Nashville General Hospital. I'm going to start by asking our panelists to tell us a little bit about themselves.
Good morning. Frank Stevenson. I serve as the Vice President of Student Affairs at Tennessee State University. I also serve as the Chair of the Board of the Nashville General Hospital.
Good morning.
I think it's that seat.
Yeah, thank you. Oh, thank you. Good morning. My name's David Lewis. I'm the Chief Executive Officer at the Surgical Clinic. We're a private practice 42 specialty surgeon group that serves Middle Tennessee with general surgery, vascular surgery, plastic and reconstructive surgery, and podiatry.
I'm Greg Jones, and I have the privilege and honor of serving as president of Belmont University. And we're opening a new College of Medicine, the Thomas F. Frist Junior College of Medicine this summer, as well as having the Inman College of Nursing and a College of Pharmacy and Health Sciences, as well as other allied health initiatives.
Fantastic. So on this panel, you'll see that Nashville has a reputation as a healthcare leader. And so we have representatives from healthcare and education. And so we're going to explore here how those relationships will help lead Nashville into the next generation of healthcare leaders, how we can just be a little bit more forward. So I'm going to ask a few questions, starting with both higher education and healthcare sectors are undergoing a significant period of change that's leading to a greater emphasis on collaboration. How important is the growth of these two industries for the trajectory of Nashville? So I'll start with you, Greg.
Well, I think it's absolutely crucial for Nashville. And the opportunities are tremendous because of the great relationships that exist and the potential for even greater collaboration. I say too many higher education institutions around the country are preparing for 1995 in case it comes back again. We're focused on what's needed over the next 20, 30 years. And the environment, both in healthcare and in healthcare business, is tremendous. And the more that we're focused on collaboration and working across sectors to address challenges and to seize opportunities, is going to be pretty extraordinary. Nashville is known as the Athens of the South, as well as a healthcare city. With Oracle moving here, it just amplifies the opportunities. And if we take a big picture look at where the opportunities are tremendous, it's important for us to look in Nashville and not think about different universities or different healthcare organizations or hospital companies. We're actually comparing ourselves as a city and then a healthcare council and other environments, what's going on in Austin or Denver or Charlotte. And the opportunity is for us to work together and create the kind of ecosystem that enables workforce to address the future and to be equipped to really provide leadership across the country and for the citizens of this region.
So I have the unique opportunity to serve in two capacities where I get to peek behind the curtain in both aspects, both in education, higher education, and as it relates to serving on the Hospital Authority Board. Two things we do great and we do good in this city is we certainly have been a leader in the healthcare delivery. And of course, as President mentioned, we are the Athens of the South. So we have great institutions. I think our challenge and opportunity is that we move from good to great in terms of how we manage the growth and how we create opportunities for connectedness and how these entities are talking to each other. And so, for instance, this particular conference creates that synergy for those conversations to continue to move forward. It is so important that we don't get status quo, that we don't get comfortable in the spaces that we have been good. There's such a great opportunity for us to move to the next level and to be better with these entities having intimate conversations about how we move forward. And so for me, I think it's really interesting when I sit in a board meeting and I'm hearing conversations and I say, wow, I need to take that back to the university. Then I'm sitting in the university and I say, oh my goodness, I need to take that to the hospital. Right? So those opportunities of cross-pollination, I think is going to be very impactful for us as we move forward.
David, from a healthcare provider's perspective, we've heard from the educators. What about from the healthcare providers?
Yeah, with the rapid growth that we have in Tennessee, it brings challenges for the workforce, but it also brings lots of opportunities for us to work together. I mean, you've got universities such as Tennessee State and Belmont and Vanderbilt, all very strong in the health sciences. You have 3 medical schools in Nashville, being Vanderbilt, Meharry, and now Belmont as well. So I think about the 42 doctors we have and how they're all leaders at their respected hospitals where they take call and perform surgery, but are, very active in the residency program, on the Ascension side of the house. And now opportunities with Belmont and with HCA and a residency program at Centennial. There's lots of opportunity that I think will continue to attract top tier students, but also top tier talent of healthcare workers as well.
David, I'm going to stay with you for a minute. So we've seen a lot of changes over the last several years. How has that impacted your organizations, and what major changes are you guys making as a result of them?
Yeah, lots of changes with growth, which, as one of the other panelists said, that's a much better problem to have than constriction. So, the surgical clinic's been in existence for 24 years, and their vision is to provide advanced surgical care for patients that need that, not only in Nashville, but in their outlying communities. So, we now have 27 clinic locations and satellites throughout Middle Tennessee and Southern Kentucky. So I think we want to continue to expand into areas as those population densities increase to meet those community needs. So people don't have to drive to Nashville for all of their healthcare and can have that same quality care in their communities.
Frank, any thoughts?
Yeah, for us, particularly in higher education, the 2 challenges that we have encountered over the last few years, one is still associated with COVID. And I know that we've moved past that, but the social development loss around COVID is still relevant. So those students who were in the 8th grade and lost the opportunity of connectedness with other students and learning to be engaged, we're seeing that now at the university platform. In the student affairs area, we have to be engaging. That even means in terms of career, where am I going? What does that look like? So we're seeing more students who are walking in the doors not sure what their career path will look like, what their majors will look like. And that's frustrating for us because at 19, we want you at 18, we want you to know exactly what you're going to do with the rest of your life, right? So as academics, it's frustrating for us. The other aspect of challenges that we're adapting to in higher education is around AI. I had a student who wrote an appeal as the vice president. I'm the appeal for any students who are suspended. I'm the part of the appeal process. Student wrote an appeal. They clearly was in violation of the campus policy and should have been suspended. Wrote an appeal to me. This is about about 2 years ago. Wrote an appeal to me. I went to the student conduct officer. I said, this appeal is amazing. Like they articulated every aspect, and the conduct officer, Dean Stevenson, AI wrote that. So we have to be intentional about making sure we're adapting to those challenges and how things are moving.
Fantastic. Greg, so you talked about a lot of the new schools that you have. Can you expand a little bit about the need for new educational programs and curriculum adjustments to address emerging trends in healthcare?
Well, there's clear workforce needs, as David was talking about, that there just aren't enough nurses, there aren't enough doctors, there aren't enough pharmacists, there aren't enough OT, PT. I mean, the need is just enormous locally and around the world. And so the changing nature of the workforce is part of what prompted us to create the Frisk College of Medicine. And yet it's also in the midst of changing workforce. And so the roles of nurses and doctors and is changing dramatically in hospital settings, in local clinics, all of those kinds of dynamics. Technology is was just mentioned is really important. AR, VR, the way in which that's reshaping the workforce is going to be really crucial. At the same time that there's been a loss of some of the dimensions of the humanity, both of physicians and nurses, particularly as well as patients. So one of the things we've developed in our curriculum is a real focus on whole patient care and discovering and reclaiming that more traditional notion of the role of healthcare professionals in caring for us as people and paying attention. And this was especially in COVID. You saw a lot of nurses exiting the profession because of the stresses and the burnout. Physicians, that's a large issue. And so caring for the professionals is also a really important dynamic. I think we can address all of those well. The technology in AR and VR doesn't have to be impersonal. It can also lead to a higher focus on the quality of interaction of people. And we need to be intentional about that and remember that we're human beings first. We're not just a liver presenting in a hospital.
Thank you. David, are you seeing some of those changes in the workforce?
Oh, absolutely. I think from a technology standpoint, people are seeking things in a more, they're looking online, they're looking for easier ways to accomplish tasks. They're looking for ways to schedule, ways to see their test results or lab results, even interactions with their providers. So it's not that you can just make a phone call anymore. You have to use all those different, methods of media, being phone, text, patient portals, email. I think AI. I don't really have a fear of that either. I think we use it to maximize those things that are very cumbersome to do. With people, like managing cancellation rates and follow up on certain dates where things need to be done by. That can actually increase our customer service because we're on things in a way that maybe patients aren't, as far as follow up and follow through.
Frank, are you seeing the same changes in the public university that we're seeing in the private universities as well?
Yeah, absolutely. And, oftentimes I think the idea in terms of students who are going into these spaces, we sometimes focus on just those who are going to go to medical school, right? But there's so many other aspects to careers in this space that we are redefining and reintroducing, right? Every hospital has to have a CFO and a COO and wraparound services and all of those other pieces that make it work. And we have to make sure that we are creating the educational platforms for those entities to also be able to provide and be available. And so I have seen a shift where we're seeing students who, they don't want to be an MD, but they want a career, in health delivery, health services, and those areas. And so creating those educational platforms has shifted in those trends.
Thank you. David, in your interview with Invest, you highlighted digital transformation, healthcare consumerism, and how and transparency as factors driving patient healthcare services. From innovative healthcare services, what extent do partnerships between educational institutions and healthcare providers deliver these services?
It's a big question. Yeah.
It was a lot today.
I would take a step back and just say, look at what we have here with Vanderbilt, with Vanderbilt, with HCA TriStar, with Ascension St. Thomas, even with Maury Regional Medical Center in Columbia, you have a really large area of lost my thought there. I'm sorry. We have to figure out a way to. What I would say about those are world-class organizations. Those are what make Nashville the healthcare hub that it is. And I think what you get with those organizations is you get competition that is healthy because everyone wants to be the best. And I think that is going to provide better quality of care, better outcomes for our patients. I would also like to say that should help to reduce cost. I think one of the challenges we face is a lot of the consolidation in healthcare. And, when you have less providers, you have less choice, and, economically that makes costs go up.
So Greg, this fall, you mentioned that Belmont will begin classes for the Thomas Frist College of Medicine. This required a sizable investment. Can you talk about how that investment will pay off in Nashville for the Nashville wider community, the healthcare and the education community?
Well, there's a need for a lot more physicians, and so that's part of the focus. But it's also in our new building, which is on Wedgwood between 15th and 12th. We have 60,000 square feet of a simulation lab, which combines both live actors as well as AR and VR, so both the personal as well as the high tech, to bring together health professionals. Healthcare is a team sport, and we need to train people more in those teams to cultivate better patient care and better patient outcomes. We also have a really strong community focus to work in the community. One of the ironies that we need to address in Nashville is a city known as healthcare city actually doesn't have very good healthcare outcomes in the city. And so we need to look more at the social drivers of health that's embedded in our curriculum, and working with community clinics. We're working with Matthew Walker Clinic in North Nashville. Turns out Nashville has a high hypertension problem. Well, it turns out if you look at the data that we've done with the Nashville, with our data collaborative, the places where hypertension's worst are neighborhoods that don't have sidewalks and are food deserts. So your doctor tells you you need to walk more and eat healthier. If you're in that neighborhood, it's not going to be very effective. So we need to look at the social drivers of health and that community focus of our College of Medicine coming alongside the College of Nursing and Pharmacy and Health Sciences with the work we do at the store. Brad and Kim Paisley's Groceries with Dignity store, one of the things you discover is the children who come there often have ACEs, adverse childhood experiences. And so bringing music therapy is part of helping care for the family, and it's also helping nurture health for children. We need to be much more focused on health outcomes in this community while also developing the entrepreneurial spirit that can help us drive the world-class healthcare that we have as a community.
Frank, in 2017, Nashville General Hospital founded the Congregational Health and Education Network. Can you talk a little bit about how the organization, how this model serves as a model for expanding access to healthcare and the marriage of education, and how that promotes health literacy?
Absolutely. So CHIN, as it's nicknamed, kind of reverse the role. Healthcare systems are designed for individuals to come to the systems, right? The delivery models that you come into the system. What CHIN says, we're going to take the educational component, particularly to communities where we're looking at health disparities, and we're going to bring that to the community. And so that model allows for a greater level of access and information to be shared across the spectrum in this city. Now, I will say this, and again, serving as the chair of Nashville's public hospital, that not only does the spirit of CHIN need to be adopted by healthcare deliveries, but also by everyone who really think that this city is amazing, right? And the challenge here is that as a public hospital, safety net hospital, we are responsible for those citizens in our city who sometimes are uninsured and need help. And I guess I'm kind of leaning in on my preacher side of this, because there was one scripture that says, you didn't do all of these things, and when you didn't do them, you did it to me. So when we do not do what we're expected to do as a city, as leaders, I'm looking across this room, leaders in this space who can champion opportunities for the least, the lost, and the left out. I wish there were people beating the drum about a new hospital as much as they did a new stadium. I wish you would get just as upset that we're not pushing to have a safety net hospital that we all know the building we're in now, we should have been out of that 10 years ago. It's not what it needs to be. But it does get a little frustrating to me sometimes that good people are sometimes too silent. Good people are sometimes too silent. Not to be preachy, but I do hope this convicts us that we'll be intentional about what we do for the least, the lost, and the left out in our city.
Frank, I think that's a great segue into the conversation about the future. So I just have a couple more questions. So how can we, thinking forward, thinking about the future, how can we partner with these leaders around in this room, with local tech startups, with the entrepreneurs? How can we partner with the universities and healthcare providers to develop cutting-edge healthcare solutions?
I'm a techie, so I love all of that, right? I think it gets us into some spaces where we need to be to do it better, to do it faster. But I think what has to happen is that, particularly with higher education, we need to be in the conversation, very early on. You would not believe, as the vice president, how many people come to meet with me about a new app, right? Even students. I just developed a new app that's going to fix the whole university, right? So, but what happens, how awesome would it be if we're in the beginning stages of those technology conversations, right? And so if there can be a little bit more collaboration around the tech opportunities at the beginning stage is what I suggest.
David, same question.
Yeah, I think there's some natural synergy that we've already thought about and are pursuing, as far as, with a shortage of healthcare providers and doctors, with residency programs, with internships. But I think when you talk about technology and some of those other things, the technology affects every industry, right? So I think partnering with some of these educational institutions to have either capstone projects or even capstone courses where you come in and you find out what the problem of that business is in real time, in real world, and that advances that student's knowledge, confidence, and education in that, but it also helps that business get beyond maybe the level they are with how they collect data, review data, analyze data. So I talked a little bit about how Nashville is a healthcare hub, and with that, you get all of these healthcare startups. I was reading an article last week that there are about 300 different healthcare startup companies in Nashville. A lot of them are healthcare tech, but also service driven as well. So a lot of these startups, they focus on, they want to know what your problem is, and then they focus what their business is going to be on that problem. So I think in communicating those problems and even roundtabling them. I see lots of other entrepreneurial opportunities and businesses that can arise to help us face some of those challenges that we face, either from a population growth or regulatory standpoint, or even, to your point, Frank, we have to service all communities, but there has to be a level of funding to where the business can be profitable and continue to grow as well. Yeah.
I'd highlight 3 phrases: an entrepreneurial mindset, intrinsic relationships, and radical champions. I want to say just a further word about the 3rd phrase. That is radical champions. When I first moved to Nashville, I was talking to someone and I said, "What's your experience in Nashville?" He said, "It's a great city. People like each other a lot." I thought, "Oh, that's great." He said, "It's very hard to get anything done." I said, "Oh, that's not so great." He said, "People will go to meetings," and I've had this experience on the United Way board and other settings where we talk about an issue and we all nod our heads and wait for somebody else to do something. What this person said to me is, he said, it takes somebody becoming a radical champion who just says, we're going to do it, and bring a lot of people alongside, but it's that sense of agency. And I said, is it possible for an institution to be a radical champion? And he said, I don't know, why not? And so lo and behold, we put it into our vision and mission. So we want to be radical champions for the flourishing of others. And it's that sense that says, look, let's identify something like we did with hypertension through our data collaborative, and now working with Matthew Walker and other partners. The mayor's office is now involved. We just said, we're going to try to do something, and others come alongside. That's the entrepreneurial mindset. And if you have intrinsic rather than transactional relationships, somebody just willing to get it done. We don't care who gets the credit. We just want to see the impact, whether it's in terms of healthcare outcomes, whether it's in terms of the kind of entrepreneurial spirit of healthcare tech and healthcare business, all of those kinds of new startups that create jobs, that create the kind of impact. But we need that entrepreneurial mindset, intrinsic relationships, and we need a lot more radical champions.
So speaking of radical champions, and my final question, how can healthcare and education, how do these industries represent the future? How can they drive economic development and create unique opportunities across Nashville? I'd like to hear from each of you. We'll start back with you, Greg.
Education is crucial because the world's changing so rapidly. My daughter-in-law is a physician, and when she started medical school, the dean of the medical school got up and said, what you're going to learn over the next 4 years, about half of it will be obsolete or wrong by the time you graduate. Unfortunately, we don't know which half, so you're going to have to learn it all. She's now in her mid-30s and now on the faculty of the UT Southwestern College of Medicine. I said to her, was your dean, when you started medical school, blowing smoke? And she said, oh, he underestimated the percentage. Things are changing so fast in every vocation. So education, we need to flip the mindset from come for 4 years or 3 years for medical school or whatever to get a credential, to a commitment to lifelong learning. And we need to be coming alongside healthcare institutions that move from a disease-based model to one that's looking at the social drivers of health and looking at it throughout the course of a lifespan. And so if both organizations and both institutions are willing to adapt and grow and change to be partners rather than a relay race model where we hand the baton to each other at various points and then blame each other when the baton drops, if we have that kind of partnership throughout life, from the earliest of children to the oldest of adults, to be ongoing learning, perpetual. It's not even continuing education, it's perpetual learning, and an attention to the conditions that foster health and well-being for all people. That's when we'll really flourish. We have all the ingredients in Nashville to lead not only this country, but to lead the world if we come alongside each other as radical champions.
Well said. I think I mentioned the quality educational institutions we have here for health services and for medical school as well. With the population increase, we want to attract the highest quality students, and then we want them to engage the workforce here, not go work somewhere else. And as you were speaking, I was thinking about just the proliferation of weight loss medicine now, not only from a general surgery bariatric standpoint, like we provide, but just with the administration of the GLP drugs. And there's lots of questions about what happens long term with that. You take them, you have great results, but you also lose tissue that you don't want to lose. There's a lot of muscle wasting that occurs with that. So how do you we've got to evolve to how we can use those drugs but not use them all the time. What's the maintenance process of that, and what is the term of that? I think that goes through with hypertension and diabetes as well. We are a mecca of the United States as far as being a healthcare city, but we have a lot of work to do as far as our residents and patients in throughout Tennessee.
So the quality of a city is immensely measured by the rigor of its healthcare delivery and higher education opportunities. And so, again, I'll say Nashville has done well. Think about all of the individuals who came to Nashville for an education, Belmont, Vanderbilt, Tennessee State University, came here for an education and stayed here, made this your home, made this the place where you raised your children, made this the place where now your grandkids are calling this home, right? And it was because you were introduced to this space because of higher education, or came here for a job with HCA and fell in love with this place. And so again, we have to continue to evolve. We have to continue to be better and do better. And I'm so excited about Invest Nashville for these type of conversations that are really needed.
Thank you. I'd like to thank everybody on the panel, Greg, David, Frank. We really appreciate your comments. Thank you.